Hey, Lindsay and Paige, what y'all doing?
Drawing a sun. How about you?
Ooh, I'm drawing a tree. That looks good. Thanks, Paige. Hey, y'all want to play tag? Tag?
Ow! I just got a shot.
Mama don't believe in shots.
You should get your Hep A and B shot.
I'll have to ask Mommy. Oh, Bob, I'm so tired and just don't feel well.
Yeah, I mean, you have gained a few pounds, honey.
Thanks, Bob. What's on TV?
I don't know, let's see.
Are you or a loved one feeling tired, feeling weak, experiencing recent weight changes, loss of muscle mass, fluid retention, jaundice? Well, you may have hepatitis. Hepatitis is the result of liver inflammation caused by alcohol toxicity, viral infection, medication, or fat deposition. Viral hepatitis comes in 3 different forms: A, B, C, or D. The first 6 months of hepatitis is considered acute. After 6 months, it is considered to be chronic. Acute hepatitis usually doesn't result in liver damage. When hepatitis becomes chronic, it can progress to end-stage liver disease, which normally takes 10 to 20 years. You should see a doctor before it's too late.
Bob, what if I have hepatitis?
Well, maybe you should go get it checked out.
Okay. What brings you in today?
Well, Doc, I've just been so tired lately, and I've been bloated, and my weight has fluctuated so much lately.
How often do you drink, if you do drink?
Come home from work, and me and Bob crack open a beer, then we eat dinner, and then maybe 2 to 3, possibly 4 beers throughout the night as we watch TV. Love me some Bob.
All right, well, I'm going to send in the nurse and we'll take a few tests and get to the bottom of this.
Thank you, Doc. I appreciate it.
You're welcome. Sounds like liver dysfunction to me.
If the doctor suspects liver dysfunction, he will want to order lab tests to test for liver function, electrolytes, glucose, blood counts and clotting factors, and hepatic proteins. The doctor will also want to analyze levels of folate, thiamine, zinc, calcium, and various vitamins. Presence of antibodies can help diagnose certain forms of hepatitis. Each antibody relates to a certain type of hepatitis. It is important to note that hepatic proteins such as albumin, transferrin, and prealbumin are skewed and altered by liver function and ascites and are not as important in diagnosing hepatitis.
So the verdict is you have hepatitis.
How in the world did I get hepatitis?
Well,
Hepatitis A is usually transported by the fecal-oral route. This method of transmission may occur when a person drinks water or eats food contaminated with pathogens found in feces. Hepatitis B, also known as serum hepatitis, is transmitted by blood, blood products, semen, and saliva. This form of hepatitis leads to the development of cirrhosis. The most common form, hepatitis C, is transmitted by exposure to blood or bodily fluids from an infected person. Hepatitis D and E are acute infections and are rare in the United States. Linda's doctor refers her to a registered dietitian. The registered dietitian reviews Linda's chart and is able to diagnose nutrition problems based on her signs and symptoms. Nutrition diagnoses may include inadequate oral intake, inadequate vitamin intake, inadequate mineral intake, inadequate energy intake, or in Linda's case, excessive alcohol intake. A possible PES statement may be inadequate oral intake related to decreased appetite as evidenced by consumption of less than 50% of food served.
Hi, I'm Franny, your friendly, fun, registered dietitian. So today we're going to talk about hepatitis and the nutrition interventions. The nutrition interventions for a patient with hepatitis is due to decreased risk of malnutrition from inadequate intake. If the patient cannot meet his energy and protein requirements orally, they may require enteral nutrition. Goals of nutrition therapy would focus on maintaining a healthy weight, providing adequate macronutrients and micronutrients, manage eating problems, and adjust nutrition intervention based on the patient's changes in health status. Acute and chronic hepatitis do not have any major food restrictions, and the patient should be encouraged to eat full balanced meals on a regular meal schedule. If the patient's chronic hepatitis has progressed to cirrhosis, the patient will need to be assessed again, and foods high in sodium or fat may need to be restricted.
Hepatitis nutrition monitoring and evaluation should focus on weight changes in the patient, food intake, and lab values. Improvement or lessening of liver disease symptoms should also be considered upon reevaluation. The doctor may ask the patient to keep track of her meals, take a supplement, or track her weight. This information will be useful for the dietitian to mark improvements in the patient's status or adjust nutrition intervention if needed.
Thanks to my doctor and dietitian, this ascites is gone.